Hi, my name is Dr. Taylor Krupp and I'm an associate veterinarian here at Central Providence Veterinary Hospital. Today, my assistant Bailey and I are going to be talking a little bit about pain management in dogs.
Dr. Krupp, if I notice my dog is in pain, should I bring them right away, or are there situations where it's okay to wait?
In general, if you think your dog is painful, it's probably best to get an exam by a veterinarian sooner rather than later. If it's smaller changes that you've noticed over time, it's likely not an emergent situation, but I would try to get them scheduled when you can. If it's more of an acute or sudden change, then I would see if they can get seen sooner rather than later.
What are some symptoms and signs that a dog is in pain?
Our pets can be very stoic at home. They don't always like to show you when they're painful. There are several different things that you can look out for, though, that may indicate they should be evaluated. One of the more obvious changes is if they are limping or holding up a leg or trying to avoid activity that they normally like to do. Some more subtle changes can be changes in appetite or energy level. You may also notice that they are licking or biting at certain areas of their body that they don't typically go after. Other signs can be a swollen or hot area on their body that, again, typically is not that way.
How will my veterinarian determine if my dog is in pain?
We use several different tools and kind of modalities to help evaluate your pet, but it can be tricky for our more stoic dogs. The evaluation really starts with the history. What are you noticing at home? What signs are you concerned about? That can help us figure out what direction we need to go. In the room, we also just start with a hands-off exam. How does your pet walk around the room? How do they go from a sit to a stand to a lay down? And then the hands-on exam is also very important. We often start with kind of a general scan of their body to see if there's any areas that are swollen, hard, or hot, and then we do an exam evaluating each limb individually, feeling their back as well as their abdomen.
What are my options for dog pain relief? Is medication the only option?
Luckily, we have a lot of different options as far as pain relief goes for pets. It really depends on the underlying cause of your dog's pain and what we think we can do to help control it. Oral medications are probably most often reached for. It's typically well tolerated, and we can target many different receptors to help decrease pain quickly. There are also different injections that we can utilize, supplements. We can also use other modalities such as laser therapy, acupuncture, and massage to help with pain relief as well.
Are human pain pills like Tylenol or Advil okay for my dog?
I would definitely recommend against reaching for your own pharmacy cabinet when trying to treat your pet. It can cause damage to your pet, but it can also limit what medications I can reach for. Even aspirin that is supposed to be formulated for dogs can lead to side effects, and it can also prohibit me from using certain medications. So when in doubt, just don't use any medications at home until you consult with your veterinarian.
What are the medications used for pain management?
I think it depends on the underlying cause and severity of your pet's discomfort. We often reach for anti-inflammatories such as carprofen or Galliprant, and then on top of that we can utilize medications such as gabapentin, amantadine, or for therapies such as Adequan injections, Librela injections, laser therapy, acupuncture, massage. There's many things that we can do. It just depends on what's best for your pet.
How can I track my dog's pain to see if they are improving with treatment?
So that's one thing that's really important, is when we're treating for pain, we want to make sure that we're making a difference for your pet. So it often starts with what your pet came in for. If it was limping, then we want to make sure that they're more comfortable when they're walking, jumping, doing their normal daily activities. If they were mainly just focused on licking or chewing at a certain area of their body that was associated with pain, we want that to resolve as well. So it really depends on what they came in for and how we can improve their quality of life.
When will my dog need a pain management plan?
They may need pain management plans at multiple different times in their life. So after procedures such as a spay or a neuter, or if they have a mass removed, those can all lead to discomfort that need to be managed appropriately. And then as your pet gets older, they may injure themselves playing ball or going swimming that need to be treated. And then towards middle-aged to end of their life, they may be uncomfortable just related to degenerative joint disease. That also needs a pain management plan. And then if you are noticing any signs of pain or discomfort at home, please reach out and schedule an appointment. If there is something to address, then we can go ahead and get started on that pain plan.